everyone. I'm Dr. Tarandeep Singh. I'm consultant cardiologist working in Tri-City, Chandigarh. So today we are going to discuss about a very important topic, that is cholesterol management. So basically, why we are going to talk about cholesterol management? As we all know that coronary artery disease is one of the major causes of morbidity and mortality throughout the world. And there are various risk factors for heart diseases, including increasing age, smoking, alcohol intake, stress, lifestyle issues, obesity, high cholesterol level, diabetes, hypertension, and many others. So, an important part of the management of heart disease is prevention. And in prevention, when we talk about prevention of heart disease, cholesterol management is very important because it has been proven over a period of time that very high cholesterol levels tend to lead to blockages in the blood vessels of the heart and the blood vessels going to the brain, which can lead to stroke and heart attacks. So basically, starting with cholesterol, first we should know what is cholesterol. So basically, cholesterol is one of the important building blocks of our life. It is part of each and every cell, and it is very important for the functioning of all the cells of the body. So basically, cholesterol we can get through diet also, and our body makes cholesterol also. But when the amount of cholesterol increases, which is more than what the body is required, so it gets depositing in the different areas of the body, including the blood vessels, which is our area of interest. So this cholesterol starts getting deposited in the inner layer and the middle layer of the blood vessels, which is known as intima and media. And over a period of time, over years, it can lead to hardening of blood vessels, which is known as arteriosclerosis, or it can lead to plaque buildup, leading to clogging of the arteries, and it can lead to angina. And in certain cases where there is sudden rupture of the cholesterol-rich plaque, it can lead to sudden heart attack, basically. So cholesterol is otherwise required for important processes like certain hormones, vitamins, absorption of fat in bile. So it is a very important thing. But on the other hand, it can lead to issues if the amount is too high. Now, when we talk of cholesterol, basically fat, we know it is not water soluble. So when it has to travel in the blood, basically, it has to travel with something actually. So in blood, we have lipoproteins, different type of carriers basically. There are different types of lipoproteins which carry cholesterol in the blood. So one is good cholesterol and one is bad cholesterol basically. So first, the carrier like that is LDL, low density lipoproteins, their function is to take the cholesterol to the different tissues, including the blood vessels. So increase in the amount of LDL, that is bad cholesterol, it can lead to clogging of the arteries, deposition of cholesterol in the blood vessels. Second, lipoproteins which we talk, it is basically high density lipoprotein or healthy lipoprotein. The function of the HDL is to remove the cholesterol from the tissues. So basically they are helping us when we talk of the clogging of the arteries, that is deposition of cholesterol in the vessels. The important thing about lipoprotein is that they have an outer layer of protein and an inner layer of lipids. Other than that, LDL and HDL, we have different types of other cholesterol also, like triglycerides, we have LDL also. So now coming to the level of these lipoproteins in our blood. So first thing is that these lipoproteins itself won't cause any symptoms basically. So the important thing is that how to go ahead for these things. So we have to basically get the levels measured in our blood. So usually when we go for a lipid profile, usually we go for lipid profile, we see the total cholesterol levels, we see for LDL, HDL, VLDL and triglycerides. So when we talk about the levels are measured in milligram per deciliter. The total cholesterol, if we talk, actually the different people, different populations have different cholesterol levels. But our period of time studies have shown that certain level of lipids are actually healthy at certain level actually. So if we talk of those levels at which they are not harmful for our body, so when talking of total cholesterol level of less than 200 is desirable. Triglycerides should be ideally less than 150. LDL should be less than 100. And HDL should be ideally more than 15 males and more than 60 in females. So when these cholesterol levels increase in the blood, which are bad actually, so they can lead to certain problems like cardiac problems, hypertension, stroke, and all those kind of things. So ultimately, we need to treat that so as to prevent future cardiac events. So there are certain lifestyle modifications which are required. Other than that, there are certain drugs which are available to us which can help in treating the dyslipidemias or deranged cholesterol levels. So most important is lifestyle modification, but first we will talk about the drugs which are used for controlling the cholesterol levels. So your doctor is going to prescribe you the cholesterol lowering drugs as per your lipid levels, your age, your side effect status. So the important thing is that the most important drugs which are available to us are statins. In India, we are most commonly using rosuvastatin and atorvastatin. Along with that, pitavastatin is also available. In other countries, we have simvastatin also. Other than that, we are using ezetimibe. This is basically cholesterol absorption inhibitor. Other than that, we use fibrates, fibric acid derivatives. They basically help in increasing the HDL and decreasing the triglyceride level. Other than that, we have other drugs, but they are scarcely used, like niacin and bile salts sequestrants, basically. So when we start taking these drugs, we have to properly take these drugs at the same time. We have to follow up with the doctor, whatever he has advised. In case there are any side effects, we have to consult a doctor. Otherwise, these are very safe drugs. They don't have any issues, but still we should be taking these drugs under proper guidance. Secondly, the important thing is that other than drugs, whenever we are taking any drugs, we should always focus on lifestyle changes because they will help us in two ways. Actually, lifestyle changes will help the other risk factors for heart disease and stroke. Other than that, when we go for lifestyle changes, the dose of these drugs will decrease. We don't have to take the maximum dose of drugs in that way. So what are the lifestyle changes which are required? So the most important thing is dietary factors. In dietary factors, we should avoid processed foods, we should avoid saturated fats, we should avoid high saturated fats basically, and we should take more of nuts, fresh fruits, vegetables, more of roughage in our diet. We should take olive oil, rice bran oil. We should prefer these things. Other than that, when we talk of basically healthy lifestyle, we should be doing adequate physical activity. Physical activity, I mean, the recommended guidelines say around 30 minutes of daily moderate level physical activity like jogging, bicycling for 30 minutes a day for at least 5 days in a week or most days of a week. Third thing which is important is adequate sleep. Adequate sleep of 7 to 9 hours is must. Actually, it helps in the repair of the damaged cells of our blood vessels and the body. Other than that, we should focus on weight loss. Weight loss is very important because obesity is a risk factor for heart disease. It can lead to hypertension, and fat is a source of various hormones which lead to a lot of inflammation and can lead to plaque rupture and heart attack. So we should focus at least minimum 10% of the weight loss, and it will do wonders to the cholesterol levels. Other than that, high alcohol intake can lead to high triglyceride levels. It can lead to deposition of fat in the liver, which can damage the liver. And then it is also an issue when we are giving statins and other drugs which are metabolized through the liver. Then smoking. Smoking should never be done. We should try to help the patient to quit smoking because smoking can lead to sudden formation of clots in the blood vessels, can lead to heart attack. Other than that, it can also lead to increased LDL and lowering of this HDL levels. So these are very important factors which should be taken into consideration. Healthy lifestyle along with medicines are very important in controlling the cholesterol levels because these things occur over a period of time, and when we focus early, these go a long way in preventing the heart disease and stroke in the patients, and it will help them to lead a healthy lifestyle. Thank you.